Hello. Can everybody see my slides? Hello. Hi, namaskar. And yeah, everybody knows me, so I need not introduce myself. And I would start by paying a gratitude to our acharyas who have documented such valuable information since so long, and our teacher, respected teacher, Dr. Nutan, who blended the Asian concepts with a modern approach, and Mayaji for her experiential aspect, right? Because that was important. And it was really lovely to go through that practicals by experiencing them. And of course, my dear classmates, for providing the synergy and also bringing to now where I am taking challenges of pregnancy, and of course, my family and friends, without whom this was not possible. And this is the outview through this journey. What is childbirth, stages, challenges faced by a baby, challenges faced by a mother, and the techniques which should be adopted for a safe childbirth, and yogic practices ensuring healthy childbirth. So, childbirth, as we know, it is a spontaneous expulsion of the baby from the mother's womb, and it has three stages: labor, delivery, placenta. And of course, as we have learned, that it is different for primary or the first time mothers and different from multigravida. For primaries, it is around 10 to 14 hours, whereas for multigravida, it is half the time, around 6 to 8 hours. Now, straight away, I'm coming to the challenges faced by the baby during the birth. So, this was a beautiful learning, abnormal presentations, which is known as mood garbha. And I was amazed by this information that Ayurveda, the apana vayu, it plays an important role. Apana vayu is the vayu which is a downward and outward force, right? So, which helps in the propulsion of the baby out the mother's womb. So, it helps, and that is regulated by this mood garbha. Abdominal presentations is because of that. Then umbilical cord prolapse, so this can be a little risky, because if suppose there is a compression, then the supply of the oxygen will be stopped for the baby, so which leads to complication. Then birth asphyxia, it can lead to mental retardation sometimes, right, because of the lack of oxygen. Then premature birth can lead to respiratory distress after the birth of the baby, or later baby may suffer from the lung problems. Then infections. So what happens in case of rupture of membranes? If the baby is inside the mother's womb for a long time, then the baby can be contaminated with the mother's diseases like HIV, hepatitis B. All those can transmit to the baby also. Then talking about the birth trauma, so it can lead to fractures and the nerve injuries on the baby. So here I would like to especially talk about cerebral palsy, which is a very common thing. And so there is a movie on Netflix known as Luca's World. It shows the story of a baby who was suffering from cerebral palsy, and the reason was because mother during the labor she suffered from respiratory asphyxia, right? So she sort of collapsed and she couldn't breathe. She couldn't, so there was a partial oxygen cut to the baby, and the baby had a palsy. So cerebral palsy, as you can see in the picture, the baby will have a very rigid movements and also delayed milestones. Then coming to the meconium aspiration. So as you can see, this is nothing but the stools, baby stool, which baby gulps during the breath. And in this, I would like to cite my own example, because for me, in my first pregnancy, my baby went into this meconium aspiration because I had a rupture of membrane, but my pains were not good enough to deliver the baby. So we had to go for an emergency CS section. Now, these are some of the challenges which are faced by the mother during the birth, right? So they are the labor pains, prolonged labor pains. So labor pains specifically, I would like to talk about the primees, the first time mothers. For them, it is very difficult, right? Because they are not only, apprehensive, anxious, but for them, it can be a very, very painful and exhausting process. So which may lead to a very prolonged labor. Then comes the prolonged labor, which can occur in case of weak uterine contractions. Then cervix, they don't dilate well. Then there is some baby's head and the mother's pelvis disproportion, in which again the labor can become very prolonged. Or to talk about heavy bleeding, that is postpartum hemorrhage. So this can happen because of, uh, can you hear me? Uh, then this shows in heavy bleeding, it can be because of placenta accreta, or when the placenta is retained inside, or it can be because of some problems, during the delivery, some complications. So this can be sometimes very, very threatening, and the doctor has to remove the uterus also, because it is threatening to both mother and baby. Then comes the, then talking about the infections. So infections can be because so definitely my classmates in the next class will talk about this, so I will not elaborate. But then these infections can be because of the unhygienic conditions of the labor room during the childbirth. Then the tears and the vaginal perineal tears can be because of the, again, when the cervix is not very adequately dilated, the pressures are there, then it can lead to, or the pelvis is not adequate enough, right? Then it can lead to the tears, or tears can be both vaginal or perineal tears. And then comes the uterine rupture. So uterine rupture is, again, I would like to state my own second pregnancy in case of uterine rupture, because there was a sudden pain and the giveaway feeling in the lower abdomen, which was because of the rupture, mild rupture, because as soon as it was open, it was an immediate emergency cesarean section, and the baby's hair could be seen. So all these challenges which I've talked to you about, which are faced by the mother and child, can be very, very detrimental for the family also. Now, these are few of the techniques to ensure a safe childbirth. So, ladies should go for regular prenatal checkups, and proper nutrition and hydration should be kept in mind. Then the breathing and relaxation techniques should be practiced throughout the trimester, which Mirala very nicely explained. Then medical supervision and timely intervention is also very important. Then support from the trained professionals. So they should be very careful about the childbirth, and all the elementary study should be done, like, where is the doctor available, or how are the midwives and doctors. So they should be very well acquainted with the place. Now coming for yoga for healthy childbirth. So this is a beautiful shloka which says, and this is also like a mantra which a lady can read during her labor pains. This is, please accept this sacred offering, Lord Brahma, who creates people and who is a Lord of people, and be pleased to protect this lady who is in the family way from all the dangers, right? So as Mirella said, that it is a birthright of a lady, right? So it is our duty that she delivers a healthy childbirth. And these are beautiful shlokas which are taken from Chark Samhita and Shishra Samhita. And the first sutra says Sukha Prasava Striyam Yogat, uh, which is so beautifully showing that how regular yoga, pranayam, and meditation can help to balance the vata dosh, which Dr. Nutan explained us, that is very much increased during the delivery, and strengthen the reproductive system and prepare the body for labor, because all these three components are very, very important. Then again, one more sutra is which is written, quoted from Hatha Yoga Pradipika and Garbhasanskar, which says that practicing yoga during pregnancy promotes the well-being of fetus and brings the ease in childbirth. So it's like maintaining the harmony in the body is very, very important, because we know, because of the so much of stress, anxiety, and other external environmental and internal factors of a woman, the harmony of her body and mind is disturbed. So we should maintain that and also prepare the mother for a smooth labor. Now, these are the four very, very important key factors which should be kept in mind during a childbirth, which is power, which is nothing but the ability of a mother to deal with the cramps and the pain. Then this can be attained by taking a good breathing exercises and walking, which helps in the stimulation of the legs, pelvis, and the thigh muscles, right? And it also tones them, which is helpful during the childbirth. Then second is the passage. So passage is the way, is the path where the child has to come, right? So it should be good, and it should dilate up to 10 centimeters, because child needs that much of path to come out. And cervix and vagina should also be flexible, right? And this can be attained by doing yoga, which helps to create the space and the flexibility along with the strength. Then comes the passenger. So passenger is our VIP guest, the fetus. So, but then fetus also, if it comes through the correct presentation, which is in the vertex or the head presentation, then only the journey will be very smooth, right? Because we have already seen the complexities of the abnormal presentation. Then I really love this, the paying attention. This is so important because everybody is worried about the passage, the passenger, but paying attention is so important to teach to a mother so that she is in a very, very relaxed state of mind and is able to maintain that energy, that calm during the pregnancy state, right? So she will have the energy to relax during the contractions. And this can be attained by chanting, affirming to boost her mental strength and seek the higher blessings. Now, these are the yogic practices for the healthy childbirth, which compose of asanas, pranayams, mantra chantings, pelvic floor exercises, our yoga, and meditation and relaxation. So I'll go one by one. So first is the asanas, the yoga poses. So there are many yoga poses, but I would like to pay attention to these four, like Baddha Konasana, Malasana, Vipreet Karni, and Marjariasana. Why I'm talking about these is because somehow if you see the correlation, they are also simulating the positions during the labor. As you can see, the arrow is pointing during those labor positions. So if the lady is very well acquainted to these positions, then it will also help in adopting these positions during the labor, right? So it also works on nothing but opening the space, creating a space, which is very, very important, because if a right position is made during labor, then the descent will happen along with the gravitational pull. The labor duration will be shorter, better, the contractions will be much more effective, and it also helps in increasing the pelvic space by around 28 to 30%. So this is very good if the lady can be taught asanas, simulating that you do this now and they'll be beneficial for the pregnancy in their labor, during labor pain. Then comes the pranayam or the breathing technique. So yes, Nari Sodhana, Brahmari and Ujjayi are very, very good. There are many other pranayams, but then again, my focus is on these three because as all our friends have been talking that during and labor, the lady is very stressed. Right, so through Brahmari, she is able to, manage her stress better and promote a deeper relaxation. Whereas Nadi Sodhana, it also helps in calming her nervous system. Then Ujjayi breathing, it helps in focusing and controlling and moving and doing a good breathing. That is a Lamaze breathing, which helps in not wearing her out, and she can practice that breathing in between the contractions. So Lamaze breathing, all of us know it's like ha, he, hu. So when we do that, we can see that how we give a nice expansion to our chest and the pressure is down, right? Which helps in the easy expulsion of the baby. Then comes the meditation and relaxation. This is also very important because happy mother bears a happy child, right? So if she's very, very relaxed, then all her fears or all her apprehensions, anxieties related to the what will happen, how it will happen, what will I do, they will be taken care, right? So she is very, very relaxed. And then Yoga Nidra, it helps us in a deeper relaxation. So not only, so this is very helpful during the childbirth, because when the lady is put in that lithotomy position, sometimes she keeps her lower legs and pelvis so tight that she might suffer an injury, right? During that, and the tears and all are very common. But then if she knows how to relax and breathe, so it will take away the tension. Then come the pelvic floor exercises. Yes, Mula Bandha is very, very good because again, if you see, I was just referring to the lithotomy position. So this is Setu Bandhasana, in which the lady is doing that Mula Bandha lock. But in lithotomy, only the legs will also be hung up there, right? So it helps in easing her lower genital area, and any damage to the anus will be prevented, right? So this is helps in the easier labor, and also the postpartum recovery is very good. So I will not elaborate because I have my friends who will be talking about the postnatal care. The mantra chanting and positive affirmations is very, very beneficial because these affirmations, they can create that mindset, that trust, that surrender, and it boosts the confidence of a mother, and it helps to soothe her edgy nerves, right? And she feels relaxed, and she can focus on her baby, right? If she's imagining, she's already practiced that, so during the labor she can focus how beautifully her baby is descending down. Yes, so childbirth is the most painful but a very, very beautiful experience. So, yes, thank you, everybody.